Welcome to today's video. In this session, we'll learn about motor neuron disease, also known as MND, a rare but serious neurological condition that affects the nerves responsible for movement. Let's understand its causes, symptoms, diagnosis, treatment, and rehabilitation in detail. Motor neuron disease is a progressive neurological disorder that damages the motor neurons, the nerve cells in the brain and spinal cord responsible for controlling voluntary muscles. When these neurons fail, muscles gradually weaken, leading to problems with movement, speech, swallowing, and even breathing. And there are several types of motor neuron disease. 1. Amyotrophic lateral sclerosis, ALS, the most common form, affecting both upper and lower motor neurons. 2. Progressive bulbar palsy, PBP, affects speech and swallowing muscles. 3. Progressive muscular atrophy, PMA, mainly affects lower motor neurons, causing muscle wasting. 4. Primary lateral sclerosis, PLS, rare type affecting upper motor neurons, leading to stiffness and weakness. Each type progresses differently, but all cause gradual disability. The exact cause of MND is still not fully understood, but research points to genetic mutations. About 5 to 10% cases are inherited. Environmental factors such as exposure to toxins, chemicals, or heavy metals. Oxidative stress, abnormal protein aggregation, and immune dysfunction also play roles. Risk factors include age, usually 40-70 years, male gender, family history, and in some studies, intense physical activity or head injury. Symptoms depend on which motor neurons are affected, but common features include muscle weakness starting in hands, arms, or legs, twitching and muscle cramps, stiffness and spasticity, slurred speech and difficulty swallowing, breathing difficulties in advanced stages. Importantly, intelligence, memory, vision, hearing, and bladder control usually remain unaffected. There is no single test for MND. Doctors use neurological examination, electromyography, EMG, and nerve conduction studies, MRI scans to rule out other causes. Blood tests and genetic testing diagnosis is often made by excluding other conditions. Currently, there is no cure for MND, but treatment can slow progression and improve quality of life. Medications. Riluzole and edaravone can slow disease progression. Symptomatic treatment. Muscle relaxants for spasticity, non-invasive ventilation for breathing, feeding tubes for swallowing problems. Rehabilitation. Physiotherapy, occupational therapy, and speech therapy play crucial roles in maintaining mobility, independence, and communication. Physiotherapists help by prescribing exercises to maintain strength, flexibility, and joint range, teaching breathing exercises to delay respiratory complications, suggesting mobility aids like wheelchairs, braces, or walking frames, providing caregiver education for safe transfers and positioning. MND is a progressive disease, and survival varies between 2 to 5 years after diagnosis, although some patients live longer, especially with modern supportive care. Research is ongoing into stem cells, gene therapy, and neuroprotective drugs. Emotional and psychological support is essential. Support groups, counseling, and palliative care help patients and families cope with the challenges. Multidisciplinary care offers the best outcomes. In summary, motor neuron disease is a progressive, life-changing neurological disorder. While there is no cure yet, early diagnosis, rehabilitation, and supportive care can significantly improve quality of life. Ongoing research brings hope for better treatments in the future. Thank you for watching. Don't forget to like, share, and subscribe for more medical awareness videos.